Hello, every single person. Welcome to this edition of Knocks to Nuggets. My name again is Oluwayomi Ute, and it's such a joy to come your way this beautiful day. Wow, today is a day of pleasant surprises. They've got to be pleasant surprises. I tell you, things happen, but somehow God helps us make it all work together for good because it's just a good God. How has your weekend been? It's such a joy to come your way today. It's another edition of Knocks to Nuggets, and I'm so proud of what Knocks to Nuggets is bringing to the table. Thank you, everybody, for your feedback. And so let me just thank everyone watching me live right now on Facebook, on YouTube. Thank you so much for your share of your time. And please don't forget, like the video, share it, pass your comments, your feedback that gets me going. And today, I'm going to a very touchy part of life. I remembered last week, somebody said, you want to talk about mental health? Everybody is going to go off the conversation. But thank you for those of you that are on the conversation, proving that we all know the importance of mental health. My guest this morning is a wonderful lady. She's a consultant psychiatrist based in Lagos, Nigeria. She holds an MBBS from the University of Lagos, MSc in Health Policy from the Imperial College London, and a fellowship with the West African College of Physicians. She founded a health tech startup called the Freudian Center, which is an employee and family assistance program located here in Lagos. This startup works tirelessly to bridge the gap in access to quality mental care for all ages and groups. She's an active member of the Association of Psychiatrists in Nigeria, the American Psychiatric Association, World Federation of Biological Psychiatrists, and the International Society of Substance Use Prevention and Treatment. She is a wonderful personality that you need to listen to when you talk about mental health. And she's no other than Dr. Olayinka Jibuna. Wow. Good morning. Hey, can I hear you? Good morning.
Good morning. Good morning. Thanks for having me.
Oh, I'm much grateful that you agreed to do this. Thank you so much for being here. It's such a wonderful day. I'm going to just go straight at you because of time. What exactly is mental health all about?
So our mental health just simply means emotional, psychological, and social well-being. In layman terms, I would describe it as the way we think and feel on the inside, which now shows in our behavior on the outside. So a classical example I always give is the woman that comes into the office and is shouting at everyone in the office, and everyone, takes cover because she's in a bad mood. But she came into the office feeling that way because she woke up that morning feeling a certain way on the inside, thinking a certain way on the inside. And by the time she got into the office, she started lashing out at everybody. Her behavior was very irritable. She was very angry. So that is the way mental health, the process by which mental health shows on the outside. So you think a certain way, you feel a certain way, and then you behave a certain way. So that is mental health.
Wow.
We all have mental health. Every single one of us is just the way we have our physical health, which we see on the outside. We all have mental health.
Wow. Now, anytime I talk about mental health, first people think about is, all the psychiatrists, somebody has gone wacko. Are you saying the way we feel on the inside is what mental health is all about? And as a mental health doctor, I'm wondering, how do you get to see what we're doing on the inside that's affecting? Because I'm hearing a lot of things. So someone that just comes cranky, angry, a father that comes into the house and all the children are diving under the bed, it's all about mental health. How do we relate this to our everyday lives?
So we are trained in the art of what we call psychopathology. We are like masters of behavior interpretation. So when you come to me and describe someone's behavior, describe how there's been a change or deviation from their usual pattern of behavior, I can, from just that little gist you've given me or that little story you've told me, I can pick out the issues with that person. And then when I get to interact with the person, I can also, the Bible says, out of the abundance of the heart, the mouth speaketh. Just interacting with someone and them sharing their inner thoughts with you and the way they feel on the inside helps you to really, hit it on the nail and get a diagnosis or find out what the real, it might not be a diagnosis, they might just be traumatized or be going through some psychological distress. So putting all this together, the narratives about their behavior and then the thoughts that they share with you, you can arrive at something concrete.
At what point does mental health become something to be concerned about? Because I hear everybody has it. I mean, everybody gets cranky at times, everybody gets upset at times, everybody throws all these tantrums at times. At what point should I begin to get worried at the tantrum or cranky level of a person or of myself? I want us to be looking at mirrors today and looking at ourselves. You know, when you talk about mental health, it's so easy to think about the next person. That person is wacko, that person is a psychiatrist, that person is good to yaba. But today I want everybody on this call and those that will listen thereafter to just look at the mirror, look at yourself first. So at what point should I become concerned about my cranky behavior, talking about mental health?
So two major things. Once there's the deviation, a deviation in the pattern of behavior, once there's a change, so you've always known this person to be a certain way, and then there's a change to B. Once you see that drastic change, sometimes it's subtle, but once you see that change from A to B, it's something to be worried about. And then it comes with a deterioration in functioning. So the person would not be able to function within the family, within the occupational setting, and even in the environment, in the broader context of the environment. So those are the two major things to look out for. Anyone can get cranky any day. I might wake up today, I feel irritable, but it doesn't mean I've come down with a mental health disorder. I feel cranky this morning and then you let me be, and by afternoon I'm back to my good old self. But once that crankiness starts to last 1 week, 2 weeks, it becomes a pattern, it now becomes something that is staying, a long-term thing. And you're starting to see me 1 month, 2 months after I'm the same way, then there's been a change in my pattern of behavior. And then within that period, you start to see that I'm not functioning as well as I should in terms of my work, in terms of my family relationship, parenting, as a sibling, in all areas of functioning, there's a deviation, then you know that there's definitely something wrong.
Okay. So somebody is asking, and a very cogent question, are there stages in mental health? And what are the signposts to look out for?
So remember I said we all have mental health. Mental health is just our psychological well-being. The inner part of us, and our physical health is on the outside. So when you have a scratch, that's your physical health. But your mental health is on the inside. And that comes out with you be feeling sad, happy, angry, all those emotions that come with it. Now, this mental health, yes, has stages. We say that mental health can be divided into 4 domains. First, we'll say flourishing, the mental health that is flourishing. We'll say moderate mental health, languishing, and poor mental health. Now, this all 4 stages are not mental disorders. They are not the person with psychosis that is hearing voices or seeing strange things or behaving. These are all just the way you and I are now. We fall into one of these 4 categories as we speak. So what is flourishing? Flourishing is optimal mental health, where you're in your best, you're at your best, doing your best, enjoying your life. Things are going so well for you. So like the term says, flourishing, you're flourishing. Things are going very well for you. And then the next stage is moderate. Moderate is just a phase between flourishing and languishing, in between. And then we have languishing, where the person feels there's a void, feels unfulfilled, feels like they're stagnant in life. Things are not just moving as they should. We get a lot of people coming to the clinic. They don't have a mental health condition, but they just feel like there's something missing. There's a void. They just feel like they're not moving forward. It's like there's a plateaued and they're not moving as they think they should. That is like their language, their mental health is languishing. And then when we say poor is just the stage where someone gets to before they now fall into a mental health disorder, where the mental health is really poor. The person has started to isolate themselves from other people. We start to see that early stages of a deviation in pattern of behavior, where, like I said, moving from behavior A to behavior B, we start to see the early stages of that in poor mental health. So these are the basic.
Wow. Well, that's still on mental health. And we're still with Dr. Olayinka Jibono. So you're talking about the 4 various stages of mental
Domain.
health. And the place everybody needs to be is on the flourishing place. That is the place to be. Now, there's still
Yeah.
a question on this floor, and it's saying, how do you help somebody that you suspect may have mental health issue, especially when people view mental health issues very negatively? How do you help the person?
So one of the first things really is being our brother's keepers. We live in Africa. Really, Africa is originally communal. The level of social support we give to our family members, our friends, makes a big difference in whether they succumb to a mental health issue or not. So our social support is very, very key. If you feel someone is drifting, they used to be bubbly, jovial, and now they're isolating. They're not talking as much. They seem to be worrying a lot. Instead of just leaving and be like, that's how the person is. Well, don't you know he's a warrior? There's always been a warrior. Reach out to the person. Reach out to the person. Talk to the person. Because sometimes just having the opportunity to share that burden within them can make a big difference in whether they move from flourishing to moderate or moderate to languishing. So it's very important that we show that support to our neighbors and our friends. Let's be there for them.
Well, another question is this. Before I start tying these things together, is there a difference between mental health and mental disorder?
Yes, there is a difference. So yes, mental health is health. Health is health. You know your health, your physical health, your mental health. We all have mental health, but we don't all have mental disorders. So mental disorder is a deviation from the norm. The norm is mental health. Mental disorder is when you deviate from the norm. And mental disorders can come in different forms. So we have neurotic disorders and we have psychotic disorders. Neurotic disorders are very common, where things like anxiety falling, fears, phobias, fear of cockroaches, fear of heights, social phobias, fear of speaking in public. These things are very, very common in the society, and people don't understand how common mental health issues are. But they're very common because these are everyday things that people talk about. Say, I don't talk in front of a crowd because I'm afraid of public speaking is my problem. People say that a lot. And people say I'm scared of cockroaches, I'm scared of the beach, I'm scared of this. So very common. These are all anxiety disorders. We have things like depression. Depression would also fall under neurotic condition, where a lot of people go through depression, but they don't even know they're depressed. They just know that they are just not their usual selves. They're just not as happy as they should be. They're just not as energetic as they should be. And they go through life just struggling and struggling and struggling like that. So these are neurotic disorders, very common, but they usually go undiagnosed and unidentified. Then we have psychotic disorders, which are the severe mental health issues, which usually show up in the hospital because the person totally deviates from normal. So the person starts to talk to self, laugh to self, eat things from the garbage, really, really serious stuff like that. So those are psychotic issues, which most times will show up in the hospital. So that's mental disorder in a nutshell.
Wow. Now, when you notice that somebody is sliding away, e.g., depression, and you want to help, how do you go about it? Remember the last question, we see mental health issues as very negative. If I want to say somebody has a mental health, everybody wants to run away from the person. They see the person as somebody who's gone wacko, who's gone mad, who is violent. They don't want to give the person a chance in between. How do you go about helping the person? And then when the person now doesn't even want you to know, but from a distance you can see these changes you have mentioned, how do you deal it?
So the key things about depression is that when people become depressed, there's something we call anhedonia, where they like to isolate from other people. So they detach from everybody else. They just want to be by themselves. They're not really happy. They're tired all the time, the change in appetite, change in sleep pattern, self-esteem drops, there can be memory lapses, there are feelings of, they start to see the future as bleak, feelings of worthlessness. So all those things, once you start to hear, they're usually red flags, Once you start to see someone that is bubbly, likes to go for that Owambe with you, and suddenly you start calling the person to come along and the person is refusing your offers, Don't just leave it at a phone call. Pay the person a visit.
Mm.
Check that the person is okay. You might start to hear things like, I wake up every day with headaches. I don't know. I just don't feel well. I'm not sleeping well. You see the bags under the eyes, the memory lapse. The person is saying things like, there's no point this life. There's no point in living this life. I'm tired of this life. Those are red flags. When you hear things like that, you don't keep quiet and say it is well, or you say pray about it. No,
Mm.
when the person will tell you, I feel like I have malaria, and you say, let's go to the hospital. It's the same way the person says this thing, you say, let's go and see a doctor. That's where we are psychiatrists come in. The person you've seen, picked out this reference, these things you're saying, no, it sounds like you might be depressed. Let's go and talk to a professional. Let's go and talk to a doctor. And then they come in. Depression is treatable. These are easy things we treat every day. So you come into the clinic and we're able to treat and get the person back to normal function, even in as short as as little as 2 weeks. I get the person feeling well again. It's important for us to intervene when we see these red flags.
But Yinka, the challenge is this. So somebody says, can we go talk to a doctor? Say, hey, so you think I'm mad, Abby? And the person can cut you off. Oh, I can't say doctor. So now, so I'm not a psychiatric patient, Abby. Is that what you are saying? Because the doctor you're going to take the person to is not the gynae, is not the orthopedic surgeon, is not the pediatrician, is a psychologist, is a psychiatrist. Person says, oh, so you think I'm mad? This negative vibe about mental health, how do we deal it? How do you present it nicely to somebody and the person still agrees to come with you?
Enlightenment is key. A lot of people make those statements because they don't know. Ignorance is the pushing, the factor that is pushing those kind of statements and those type of behaviors. When we know, the more we know, the better we accept these things. Mental health applies to every single one of us. The role of the psychiatrist or psychologist is just to nurture your mental health, to make sure that you don't deteriorate and move from flourishing to poor mental health, and before you know, you fall into a mental health disorder. Is to keep that mental health flourishing as much as possible. That's the role we play. We play, most times we even play a preventive role, because not everyone that walks into the clinic comes in for a mental health disorder. Some people just come in and say, oh, I feel there's something missing. I feel a void. I don't know what's good. I need to find my way back, which is where we're talking about languishing. And then you're able to walk them through the process and they go back to flourishing again. So it's just important for us to share what we know. I like what you're doing. Things like this, we're enlightening people. We're showing people what mental health is really about. When you have people like that, give them literature to read. Send them videos on WhatsApp. Let them see what it really is, and that is not so terrible. It's not such a bad thing. And get them to understand that mental health applies to every single one of us. It's about how we manage our health. How we manage our mental health determines if we do come down with a mental health disorder at some point in our lifetime. Because we say there's a lifetime risk. The study in Nigeria showed that there's a 12.3% lifetime risk of coming down with a mental health condition at some point in a person's lifetime. So a person might not have a mental health condition right now, but in 4 years' time, in 5 years' time, they can have a mental health condition. And what will make that difference is the lifestyle changes that they've adopted along the way. So I'll give an example. You might have a young girl who is in the university right now studying, and then in 4 years' time, she gets married and then comes down with postpartum depression. Postpartum depression is a mental health disorder. I'm sure she didn't see herself coming down with a mental health condition in 4 years' time. However, if she had enlightened herself with a lot, if she had in the university, they had a lot of mental health discussions and shows, and she got to know about mental health, how to identify the signs, how to manage them. By the time she comes down with that illness 4 years down the line, she already knows what to do. She knows how to properly seek for help. She knows the importance of the help she's getting. And then she bounces back very quickly. And she's back to her good old self. But someone that has no idea, hasn't enlightened themselves, is most likely going to deteriorate really bad and be dragged or carried to a hospital at some point because things have really gotten out of hand. So enlightenment is key, number one. Number two, exposing people to people that are living with a mental health condition and are doing well. So we have that a lot in the West, where you have people that have gone through one mental health condition or the other, and they come out and share their stories with other people. and people learn from them, learn from their experiences, and feel like if this person can go through this and bounce back, then I can do the same. We should have this kind of conversation, more of this kind of conversations on this side of the world. We should not be ashamed to come out and talk about our experiences. And when people listen to your stories, they identify themselves in you, and you're able to help someone else out of their own predicaments. So it's important.
That's cool. Before we go to the next question, I just want to dovetail on what you've said. Next Monday, somebody who has gone through depression is coming to tell her story and how she came about it. And I was so happy when I reached out to her and said, "No, Yomi, I'm good to go. I'm ready to tell the world, yes, I went through this, but here I am today." But the truth is, Zinka, very few people. The stigma in the society that you had a mental breakdown is huge. And that takes me to this question. What are some of the effective ways of normalizing acceptance of people with mental health issues in Nigeria, considering our cultural uniqueness? Abroad is not a big deal. Even your employer will help you through it and bring you back. Your colleagues will give you support. But in Nigeria, for fear of contradiction, 60% will not want to work with you again. How do we handle it? I know, yes, we've talked about awareness. Is there any other thing we can do?
So I'll say this type of intervention, it's multi-sectorial. It's not just at the individual level. It starts from the government, and then the society. We all have a role to play. The government has a role, the society has a role, we as family units have a role to play, and then we as individuals have a role. In terms of the government, it starts with policies. In the West, there are policies in place where you cannot discriminate or take a person's job from them because they've come down with a mental health issue. It will become a legal issue, and the person will take you to court and win the case. Same thing with other chronic illnesses like sickle cell, HIV, and all the others. We've seen a bit of that with HIV because of the policy changes that have occurred, where you cannot just wake up and say because the staff has HIV, then you sack them from the job. It can become a big deal. We have to do the same for mental health. And it can only start when we understand that every single one of us has mental health, and no one is immune from mental health disorders, because it's all about how you manage your mental health. The way you manage your mental health determines if you fall off the track into a mental disorder or not. So that is something we should all consider when our legislators are at that seat now, that have that opportunity to make these laws and adjust legislation, should factor that, put that into consideration. But when we go with the mindset of it is them, it is not us. Who are the people with mental disorders? Are them. It's not us. It's not in my family. It's not us. It's not. We don't care about how we don't care. But so we need to get them to understand that it's about us. Every single one of us has mental health. Therefore, when we have opportunities to prioritize or put policies in place, we should do it, because we never know who might be the next person to fall off the track. Now, in terms of society, the stigma is real. Like you said, the stigma is real. In the workplace, in several settings, in the church, in different places, you have that stigma is real because of our culture. We attribute a lot of things to diabolic causes, supernatural, spiritual this, spiritual that. Everything always has a spiritual connotation to it. We feel the person is being punished for one thing or the other, or we always come up with different kind of excuses, but it's just an illness. Why do we say, as doctors, why do we say it's an illness? Because the way I can treat someone in depression here now, I put the person on certain medications, and within 2 weeks the person is fine. It's the same way if I traveled to Ireland or anywhere, or Canada now, and I did the same thing to someone in depression, there, the person will still get well. That is what makes me realize that it is a disease, it's a condition. It's like malaria, it's like an infection. I put your medications, you get well. Therefore, it is just a disorder that can be treated. It's no use attributing anything more than the ordinary. If it's something that we give medication now, then we don't get a result, we could say, oh, maybe there's more to it. But the truth is that these things are easily treated. A woman comes in with postpartum depression, it's easy. She can be easily treated. A person comes in with anxiety, easily treated. These things are very easily treated, and there's no use attributing anything more than the ordinary to them. So we need to enlighten the community as a society. people that have access to the media, print media, visual media, and something like what you're doing. When we have the opportunities, let's engage mental health practitioners. Let's talk about it. Let's share. Let's have these discussions. The more people hear, the more they start to understand. Then, as
The more
family
people
unit,
hear.
as family units, it's important for us to be there for one another. Like how I said, let's be our brothers' keepers. In the past, Africa was very communal.
Yeah.
We would rally around each other. A woman has a baby, gives birth, everybody will show up, take care of that mother. I'm sure in those days they had even lesser incidences of postpartum depression, because everyone will rally around the mom, take care of the baby, allow her sleep well. Now we see a lot of women having babies and doing everything by themselves. They are sleep deprived. A mother that is sleep deprived after
So much is going on in this space. So much is going on in this space. I just pray everybody that's on this call is listening and taking it home, because honestly, you cannot finish talking about mental health. I know her network is a bit challenged, but she's going to
Hello.
come on and continue. Yes, we are here with you. Go ahead. Go ahead. So while she's going to come back soon, yeah, are you back with us? Somebody rightly said, is mental health connected to village people? Please don't crack me up. We always talk about village people all the time, when all we just need is to have a conversation with the right person. It's not about village people. It's so much we need to do. It's all of us getting into the conversation. All of us. MVP, my village people. Emeka, just leave me alone from Canada. It's unfortunate. That's what we all see it about. We need to have this conversation again and again and take steps to ensure proper policies, good handling, and clear understanding by everyone, you and I. Like she said, the fact that you don't have a mental health disorder today does not mean you would never have it. I don't pray you do, but you will be able to know when to stop, when to seek help, when you listen to things like this and share it with others. It's important we get it right. Her network is having a challenge, but when she comes back, she does have a lot of questions to answer, a whole lot of questions to answer. But the problem starts with us trying to hide it. Many times we want to hide it. Somebody is asking, are there mental support system in our climb? I know there are. She is one of them, and I pray she comes back on time to be able to throw more light into this. But the challenge is this: many people are even afraid to go to seek those help. There's so many psychiatric doctors out there, but very, very few people are ready to open up and say, I think I have a challenge. I think I need help. I think I need to talk to somebody today. I'm so happy that next week we're going to be having somebody who has been through it all come to talk to us. And thank God she's back. She's going to throw more questions to this. Yinka, before you went off, you were talking about all the support systems all around us. Are you with me?
Okay, yeah. So I said we are the support system for our family and friends. It's important that we keep the support active. Support doesn't just come with once in the blue moon, check on the person once in the blue moon. Let's be more active in checking up on our relatives and our loved ones. Once we see a deviation in their usual pattern of behavior, it's not something we should sweep under the carpet. We should check with them, talk to them, get them to open up to us. Because remember, mental health issues start from the way we think and feel on the inside. So that's where it usually starts from. You're thinking a certain way, you're feeling a certain way, you're keeping quiet about it. You're overthinking things, you're worrying about things, but you're quiet about it. Nobody knows. You're just going around, they don't know there's a lot going on in your mind,
Yeah.
and then people now realize once your behavior starts to change. That's when people see that there's something wrong. But it all started with the thoughts. So once we see a person that used to be very bubbly, jovial, or the person is expressing a lot of worries, or sometimes you might not even have to see, once you see that their economic situation has changed, or certain things, or they're going through some issues, like, let me not say issues now, because stress can be use stress and distress. There's good stress and there's bad stress. So they just had a baby, which is good stress, but it's still stress. We come around them and help support them during that period, because that's good stress. That good thing, that good thing that they just had a baby can be a source of breakdown for them as well. So when you see things happen, they just bury their mother or father, you know, it might be good if the person lived to 100 years or more, it might be good, but it can be good stress, it can be bad stress. But when we see things like that, those are times when we should rally around our friends and loved ones and show them support. The more support we give, the less likely people will come down with one thing or the other.
There's so much to talk
I
about here,
like.
but let me ask you this. Yeah, our mental health support system in our climate, are they available? Do we have them?
Oh yeah, so the support system that exists, yeah, I think we're even getting better because now you can get a network of mental health professionals.
So she's saying, yes, we can get them. There is a network. That's interesting. Mental health professionals. They should come out one of these days and have a good program and have a panel and an enlightening of mental health professionals. Wow. I was going to ask her, and I wish we'll get her back, even though time is fast spent. Is there a difference between a psychiatrist and a psychologist? Okay, she's back. Talk about the network for us. You're back.
Okay. So which one do you, so the difference between a psychiatrist and a psychologist, or the network? So in terms of the network, now we have like in terms of network, we have like an ecosystem of mental health professionals, ranging from, in the past, all we had were the psychiatrists and the psychologists, and then with the brain drain in the country, there were very few. But now we have like an ecosystem of psychiatrists, psychologists, coaches, therapists, even churches, pastors, so the counselors, people that go study counseling. So there's an ecosystem. Even your sister in the house, brother in the house can also form part of the ecosystem as long as you're
So there is an ecosystem. Interestingly, you and I on this call, we are part of the ecosystem that can provide support.
Now, the difference between the psychiatrist and the psychologist: a psychiatrist is a medical doctor.
Okay.
A medical doctor that went to school to study medicine. And just like how you have someone now go and specialize in cardiology or as an obstetrician or gynecologist, so same thing, a psychiatrist went back to specialize in psychiatry. That is the study of human behavior. A psychologist most likely is a bachelor's degree in psychology, which is a 4-year degree in the university, and they come out and then they practice psychology. So that's just the difference. It's usually good to start off with the psychiatrist, because when you have a health problem, like how you will go to a hospital and then they will get you to see the GP first to ask.
Okay. Network has been very beautiful to us today. And honestly, this topic is huge, is big. It's not something we can finish in one session. I'm trusting that.
So just like how you go to a hospital, are you there?
Yes, I'm here. Go ahead. Go ahead. Okay, I'm sure she would come back. Network has been wonderful. But like you heard her, psychologists and psychiatrists, they're different. But it's always better to start with the psychiatrist. Go to the hospital, get checked out, and then they could refer you to a psychologist. Let's not stigmatize this thing. All of us are part of the ecosystem, the support system required to help people who are challenged mentally. And like she said, as little as losing your job can be huge in the issues of mental health. Somebody who has just lost his or her job can lose it all. But if you are there for support, the person will be able to deal it right. So yes, Yinka, thank you for coming back. Let me take you to this question quickly. There's so many questions on, but let's take this. What do you think of child abuse? Do you think child abuse, parents beating their kids, contributes to mental problems as an adult?
I think this is a controversial question. So corporal punishment. Is corporal punishment the same thing as child abuse? It depends on how you use it.
Yes.
So when we talk about discipline now, discipline is classified into three major categories. We'll talk about aversive discipline, which is punishment. We talk about positive reinforcement and negative reinforcement. Corporal punishment falls under aversive form of discipline or punishment. Now, if punishment, these three domains of discipline can be used at different intervals. But if you find a parent always focusing on that aversive style, punishment all the time, aversive punishment all the time, it can be termed as abusive because it becomes excessive.
True.
That's not the only way to discipline a child. That's not the only way to discipline a child. When it even becomes excessive, it loses its effect. The child becomes
True.
so used to being beaten that it makes no difference anymore. They are ready for it, and it doesn't matter anymore. So, as professionals, we advise that we move across these three types of discipline, which is positive reinforcement, negative reinforcement, and aversive. So, positive reinforcement is sometimes the child does something good. The child does something good. When the child displays a behavior you like or you're happy about, reward them positively. Positive reward can be in terms of praise, in terms of thank you, positive affirmations, just to let them understand that this thing you've done is good. And I want you
Good.
to repeat it again. I want you to continue. And then because the child got positively reinforced after that act, right after the act. I'm not saying that the person did something good now. You positively reinforce them next week. No, you haven't passed across the message the right way. It should be like after the act. So the child does something right this minute. You let the person know, oh, thank you. Oh, well done. You've done so well. Oh, you're so good. You're this, you're that, you're that. Person understands immediately. Even in schools, they do that. They give the child a star. They give the child a thumbs up. They do this. The child understands that this thing I just did was good. It's an act I should continue to repeat. That's positive reinforcement. Negative reinforcement has to do with a child engages in an act you do not like, and then you take something the child likes as a way of correcting that behavior. So I'll give an example now. A child likes their PlayStation. The child enjoys PlayStation game or watching DSTV. And the child, you have asked the child to do his assignments. Do your assignments before you watch TV. And realize that the child hasn't done his assignments. Or which example? Yeah, I think that's fine. So you ask the child to do assignments, and the child hasn't done his assignment. And the child is hoping to watch DSTV by 7. You withdraw that DSTV by 7 because the child hasn't done what he's meant to do. Now the child gets a message. I don't get to, which is what in the West they'll say you're grounded or you're this or you're that. You take away something the child likes or a reward or something the child has been expecting so that they change that behavior. So once you identify the behavior,
Several ways of disciplining a child, clearly. So it's not all about beating. That again tells about what Praise for always said in one of our past editions. You don't have to beat. You can do a lot of things to correct a child. Yeah, go ahead, Inka.
okay, so because the child likes that thing and doesn't want it taken away, the child would adjust his or her behavior. So that's another, you've disciplined the child as well to adjust to do what you want the child to do. Now, moving on to aversive style of punishment, where every time the child does something, so the child hasn't done the homework, but instead of looking for another way, you beat. The child hasn't done the homework, you beat. Now, the child might not understand that he's being beaten because he hasn't done the homework. The child just sees the beating and sees the beating only because it's punishment, it's painful. And the child, and you do it repeatedly, I don't know why I'm always being beaten, because they might not even get the message. But what usually works, when beating works when you beat and then you're warm afterwards. So you beat the child, but then you pull the child closer afterwards and let the child know why the child has been beaten. So the child didn't do the homework, or the child tore his exams or
Wow, so much.
child,
Network is
honestly, it'll
really
be
going
something
on.
serious. For you to beat the child, it should be something serious. You shouldn't beat the child over trivial things. The child crossed the road, you beat the child. The child did not eat, you beat the child. It loses its touch.
True. True.
The impact is lost.
Let me take you to this because now, wow, 40 minutes, we're going to round up soon. With COVID-19 and its challenges, has there been an upsurge in mental health issues?
Oh yes, with the when the pandemic was really hot, that was last year.
Mm,
We saw a lot of people come down with anxiety disorders and depression, and even substance use. Level of substance use also increased during the pandemic. Well, as the pandemic now improved, these cases went down, so people started to do better. But during the heat of the pandemic, when the numbers were rising, people were dying a lot. Yes, we saw a rise in cases of mental health
mm.
disorders.
Wow, it's a whole lot to talk about on mental health. I think I'm probably going to find time to bring you back again to talk about this issue of mental health. There's so many questions here I'm unable to take. Maybe I should take this last question. This last question says, Ma, I'm taking this because a lot of us probably fall into this category. You are trying to help somebody. You can see the person is having a challenge. And the person is telling me, I'm okay, I'm okay. And yet every day she's getting out of hand. What do you do?
Sometimes there's something we call staging and intervention, where
Okay.
you bring the entire family together to make a decision on behalf of the person.
Mm,
Because sometimes in those kind of situations, maybe judgment is impaired. With some mental health conditions, there can be an impairment in judgment where the person is no longer seeing things the way they should see the thing. They're not judging the situation rightly. So in those kind of situations, you can call the family together, have a meeting on behalf of that person, and stage an intervention on behalf of that individual, which means taking the individual to the hospital to get the help that
mm,
they actually need. So
mm,
in the field of mental health, it's allowed. It's different from
mm,
other fields because we're aware that sometimes there can be an impairment in judgment, and then the family has to step in at that point.
mm. Another thing about staging an intervention, you could bring a psychiatrist if you are close enough to one to come around the house, right? And interact with the person without the person realizing what's going on. Will that work?
Yeah, that has worked. I've seen that work several times. So just
Okay.
getting the person to warm up, they feel they already had this bias when it comes to psychiatry. So you bring the psychiatrist close. The person warms up to the psychiatrist and says, "Okay, this is not such a bad thing to do, or not a bad thing to interact with a shrink." And then from there, it can lead to something else.
Very true. Thank you so much, so much, Inka. We definitely are going to come back. Everybody is saying, somebody says here, as the honorable spokesperson of the Knox to Nuggets show, we are happy to announce that we want Dr. Olayinka Jibuno to come back for another episode because it's been so rich, it's been so enlightening. And the truth is, the areas we're talking about is that no-go areas, so to speak. Nobody wants to talk about it, and it's eating us deep every single day. We need to help ourselves. Yes, when judgment is impaired, stage an intervention. Just help the person. And again, like I said at the beginning, you also look into the mirror. When you can see that you are unnecessarily cranky, slow down and ask yourself, what is it? Everybody can have this challenge. So it's not to a particular group of people. I wish we had time, but whenever I'm going to bring you back, one question I'm going to be asking you is this: is it genetic? Is it hereditary? So, father, my father had it. Does that mean I must have it, or my children too would have it? Does it flow in that way? I will keep that question until
Oh,
the
I can
next
answer it right
episode.
now if you want.
Okay, tell
I can
me.
give you the answer right now. So when we talk
Yes.
about genetics and hereditary factors, it plays across many health conditions. Look at hypertension. A
Yeah.
father is hypertensive. There's a risk of the children coming down with hypertension, but that does not mean the children will come down with hypertension. What
Mm,
if a father is hypertensive, has four children with hypertension? I mean, four children. It's not guaranteed that the four children will come down with hypertension. It's about their lifestyle choices. So now, if
mm,
Mr. A, the first child, Mr. A makes certain lifestyle choices where he's sedentary, he drinks a lot, he's eating a lot of fatty foods, just generally doing things, not exercising, he's more likely to come down with hypertension as time goes on. And if the other three are very healthy, fit farm, eats very, exercise well, they might not come down. So it's about the lifestyle choices you make. That's what makes that risk a reality.
mm.
Same with mental health conditions. You can
Wow.
have a parent that has had depression, for example, and the parent has 4 children as well. There is no guarantee that the 4 children will also come down with depression. It's about the lifestyle choices that they make. It's about the decisions they make that help them remain resilient throughout life's adversities or life's challenges. So those are the things that now determine if they come down with depression at some point or the other. So we've seen people with parents with one mental health condition or the other, and none of the children come down with any mental health issue. We've seen parents with that, and all of the children come down with mental health issues. So it's all about the lifestyle changes those children make.
It's all about lifestyle changes. I'll take that as your final word for this episode. Thank you so, so much, Dr. Yinka Jibono. And I want to say a very special thank you to Dr. Damilola Mati for making this happen. She was the bridge that made this happen, and I truly do appreciate you. Next week, Monday, we'll be talking to somebody who has gone through depression and who is out of it today. Dr. Vivian will be in the house talking to us about depression, the stages of depression, how to identify it, how to come out of it. But until next week, I want to say thank you again, Yinka. I will definitely come back, and I will come back soon. God bless you. Have a wonderful
Thank
day.
you. Thank you for having me. Thank you.
Yeah. Wow, that was explosive. That was informative, that was educative, and it was also inspiring. It was a way to bring it to all of us that some things we just need to be conscious of. So that's it for today. It's been a long session, but I think it's been worth it. Again, like the video, share it, let somebody know about Knocks to Nuggets. Until I come your way next week, Monday, still talking about this very important thing, mental health, but specifically talking about depression with Dr. Vivian. Looking forward to seeing you at that edition. And never forget it. If you can think it, you can do it, because the big is in you, and together we win. God bless you. Thank you so much for being on this program. Love you.